Bulbinaga Fiji. Earlier today, we announced that we will not be implementing a full lockdown of the Suva area this weekend. That advice stands. All existing restrictions, including the closure of non-essential businesses and the 11 p.m. until 4 a.m. curfew, will remain in effect, and the current containment area borders are unchanged. No lockdown simply means we will not be enforcing a 24-hour curfew. That does not grant a license to anyone to leave their homes without an essential reason. Home is still the safest place to be. As our testing over the past 24 hours has proved, the virus is very much present in our communities. After another 1,349 tests, we have confirmed 7 new cases of COVID-19. All are local cases. The first is a 30-year-old woman from Field 4, Lautoka, who presented to Kamikami, the health center, with severe COVID-19 symptoms. She had been sick for 3 weeks. She has also been admitted to the Lautoka Hospital Isolation Unit, and members of our household have been quarantined. This patient did have some contact with medical officers and nurses within the health center, which requires us to temporarily close the center to the public. However, the level of exposure among our clinical staff is not as extensive as was the case for Lautoka Hospital. We expect the center to reopen to the public following a thorough decontamination exercise. Our second case is a 20-year-old woman who presented to the Makoi screening clinic with COVID symptoms. Investigation have revealed she had contact with the household of the Makoi family cluster, but was not identified at the time of contact. She was not identified as a contact at that time. She has been entered into isolation along with her household members. 3 of our household members have since tested positive for the virus. This case again highlights how important it is for everyone to download the Care Fiji app. Some of our recent cases have shown us how unreliable a person's memory can be during a contact tracing investigation. And these gaps have cost us dearly. The sixth case is a 26-year-old male and is the husband of a previously announced local case, case number 75, from Kerembula, Nandi. He had been in border quarantine facility in Nandi since April the 18th and does not pose any transmission risk to the public. The seventh case is a 35-year-old male from Saru in Lautoka who presented with symptoms at Natambua Health Center. He and his household contacts are being taken into isolation. The recent cases from Lautoka and Suva are troubling, as they point to a wider transmission in these areas. In response, we have to widen our approach, and we have taken some important steps to enlist the private sector as part of the whole of society containment effort. To increase quarantine quality and capacity, we will be using several of Suva's hotels and motels as quarantine centers for primary contacts of new cases. To lighten the patient load on our healthcare facilities, as we are doing in the West, private general practitioners in the Suva Nosori Lami corridor will soon offer non-COVID related treatments and consultations to those Fijians who normally cannot afford to visit a private practitioner. Government will directly pay the private practitioners for the treatment and the consultations provided for such people. For those under home quarantine orders, we will be outsourcing grocery delivery services to private companies. That means that government will directly engage private companies to deliver groceries to the family under the stay-at-home orders. This engagement of the private sector is being done in conjunction with the Ministry of Economy. Bringing these companies on board does more than lend efficiency. It allows business in Fiji to earn money and reignite employment and hiring. Quarantine centers will be in more hygienic facilities that are better run and more comfortable for patients. Fijians will have more options for medical treatments and consultations. The pace and efficiency of grocery deliveries will step up. Government, of course, will fund these activities, but it's the private sector that will manage them, allowing my teams to focus their energy and resources entirely on matters relating to the containment of the virus. This is a model that has been adopted and is working well overseas throughout the pandemic. Our investigations have also revealed more about case 128, the nurse who worked in Rewanga Health Center. All 37 of the staff of the center have tested negative. Following decontamination, we expect to reopen the facility soon to the public. The nurse had received her first dose of the vaccine. However, everyone needs to complete the full dosage regime, meaning 2 doses to achieve full protection from the virus. She had Care Fiji installed and kept it running while she was away from her home and at work. She has told us that she was diligent about mask wearing. This is a positive sign, though we are still aggressively tracing her movements and identifying all those that she has contracted. Her husband, who is case number 129, also had Care Fiji installed. Through most part, he did not travel. He spent most of the days at home, which is a very good thing. By mostly staying home, it's likely he's cut off his own chain of transmission before it has a chance to begin. The couple reside together in Kinoya with no other household members. We have not linked either case to other patients. There are a few points of interest in the nurse's travel history, but none are definitive as a source point of transmission. In response to these clusters, our mobile screening teams will be targeting Makoi, Kinoya, Saru, and Rewanga areas for the next several days. I hope everyone is familiar with the screening procedure by my team. My teams will go house to house, checking individuals for COVID-like symptoms and asking simple questions to determine the travel history of Fijians in the area. Public honesty and cooperation are keys to the success of this operation. The results of the screening exercise will determine the need for larger, more stringent lockdown. There is a measure of absolute that is a measure of absolute last resort that will be taken only and if only the data we obtain provide us with no other medical recourse. I know these cases may serve as a shock to many of us, but there are evidence that our mobile and stationary screening exercises are actually working. So we will continue to rely on these methods for flushing cases from the community. Though I must say that every new case that we have is stretching our contact tracing and our testing capacity even further. Though we are testing record numbers of sample every day, and testing is happening at 5 ministry laboratories across Fiji, we are concerned that we are seeing delays in turnaround of some of the test results, although not that of the priority samples. We've improved the situation with the receipt of new machines, and there is more that are expected, and the engagement of additional staff. However, any delay in the turnaround of results is worrying because we need results of tests as soon as possible in order to identify cases quickly and launch an effective response. Therefore, we will now be resetting our testing strategy to target our containment areas of Suva, Losori, Lami, Nandi, Lautoka, and Ra. While areas outside of these zones, we will stop mass testing and revert to the testing protocol that we had prior to the outbreak. We must use all our resources to take the fight to where we know the outbreak is happening. Now is the critical time. I'm sure more than a few of you listening are keen to know whether or not there is a case in your area. You should assume there is already one. you should act as if there is already one. In fact, you should assume that you yourself have been exposed to COVID-19. Cases of unknown origin in Fiji are rising daily. That means we have unknown infected individuals among the public who could still be highly contagious. These infected people could already be in our community, on the bus that you ride, in the supermarket that you shop at, or at your place of work. That is why every Fijian must take every possible measure to limit their chance of being infected or infecting others. Wear a mask, maintain physical distance, install your Care Fiji app, keep Bluetooth switched on, cough into your elbow or in a tissue which you immediately discard. Avoid physical contact with anyone else if you can help it. And if you feel well, visit the screening clinic or call 158. The earlier you can be diagnosed, the safer you are, the safer your loved ones are, and the safer we all are. Now, I also want to prepare everyone for the fact that we may be entering a stage of the outbreak where it is no longer useful to state the details of every new case that we confirm. We will always inform the public on the number of active cases in the country and provide the necessary details to help with contact tracing. But if we start seeing a larger number of cases in different parts of Viti Levu, our priority will be on giving prompt and accurate information on the broader outline of the situation at that time, along with any vital information people may need to stay safe. Yesterday, we announced that non-essential businesses outside of the containment area should close. To be clear, that was a request. I use the word should, not must. All essential businesses are recommended to close, but only the closure of high-risk businesses such as gyms, movie theaters, video gaming shops, cyber cafes, taverns, bars, billiard shops, amusement arcades, as well as hairdressers, barber shops, spas, beauty therapy, massage therapy venues, saunas, and tattoo parlors will be enforced by the police. As I've mentioned before, maintaining a safe physical distance within these sorts of business simply isn't possible. And as I covered yesterday, private clinics in Nandi, Lautoka and Ba will soon offer government-funded treatment and consultations to members of the public seeking non-COVID care. I want to thank doctors who have stepped forward. Once the contracts are finalized, we will announce those who have stepped up to work with us. As I mentioned earlier, this same arrangement will soon apply to Suva, Lami, and Nosori. As we go forward, we will have to take measures to ensure that this disease will not cause disruption of functions that are critical to the nation's welfare and security. Critical assets like health facilities, water, power, telecommunications, agriculture, banking, and others will have to establish procedures to prevent infection from spreading among staff. That means we will have to work in isolated, self-contained units, bubbles if you will, in order to minimize the contact of staff members who come into direct contact, or in order to minimize the number of staff members who come into direct contact with each other. Anyone who can work remotely will have to do so. We urge all businesses to take measures to minimize contact among staff members. Employees who must work closely together should remain within their group or bubble and not interact directly with other employees. We will be issuing specific guidelines to assist these businesses. We are aware that a number of people have been displaced from their homes due to the establishment of containment areas across Viti Levu, starting in the Nandi Lautoka area on April 19th. There are currently 6 containment areas across Viti Levu: Nandi Lautoka, Raikaraiki, Nosori, Suva, and Lami. From 4 a.m. tomorrow morning until 11 p.m. Sunday, those on Viti Levu who are currently outside of the containment area they live in will be allowed to return to their homes. So this is from 4 a.m. to 11 p.m. tomorrow and Sunday 4 a.m. to 11 p.m. The curfew hours still apply. This includes those who are stuck in one containment area and have to move to another containment area in which they reside, or those in a non-containment area who need to move into a containment area. So it does not apply to those who are in a containment area who want to move into a non-containment area. Only the non-containment to the containment or containment to containment. This is a window for one-way travel only. Those who enter a new containment area will not be allowed to leave until such time that the containment area borders relax. As you travel, this is across every single border, police will be taking contact tracing information on each border point. This is to assist us should we consider you a person of interest. I know there are some people within a containment area who are looking to move to a non-containment area. We will have to work out a separate date for you. Please note that these movements, once approved, will be limited to Viti Levu. That means you can't leave Viti Levu to go anywhere else outside of Viti Levu. You can't go to Vanua Levu, you can't go to Lau, you can't go to any of the other islands. This battle we have to contain in Viti Levu. My friends, we've already lost one life in this outbreak. There's still time to save many more. Today, our COVID-safe habits are the best defense we have. Tomorrow and through the coming weeks and months, more Fijians will have the opportunity to protect themselves through vaccines. And we can build more meaningful long-term resilience to this virus. We've administered more than 24,000 doses from the latest COVAX shipment of vaccines. Another 21,600 doses were received from COVAX last night. Also, we got 10,000 doses arrived in Fiji last night from Australia, the first of many monthly installments. Vinaka to the Australian government and the people, we wish them a speedy containment of their new community cases in Sydney. To date, we have administered more than 93,000 first dose of COVID-19 vaccines, surpassing our timelines on numerous occasions. This month, we will start administering the second doses of vaccines in line with the proper dosage timeline for 6,000 of our frontliners, making them the first fully vaccinated Fijians. In the interest of protecting everyone, we have details to announce about the next deployment of schedule of vaccines tomorrow. This outbreak is far more serious than anything we faced last year. But thanks to these vaccines, the light at the end of this tunnel has never shone brighter. Keep the faith, Fiji. Keep faith in the science. Keep faith in each other. Stay strong, stay safe, and let's stay the course together. Thank you.
So as just announced by the Permanent Secretary, we have 7 new cases to report. With these cases, there are now 49 active cases in isolation, 9 are border quarantine cases, 34 are of local transmission, and 6 are under investigation. So now Fiji has had 136 cases in total, with 84 recoveries and 3 deaths since our first case last year on March the 19th. There have been a total of 61,403 COVID tests, with a daily average of 1,484 tests per day over the last 7 days, and 1,349 tests were conducted yesterday. Our overall test positivity is 0.2%, and our 7-day average daily test positivity is now at 0.2% also. Thank you.
Thank you, PS and Dr. Lisha Nisambul-Banaka. Good evening. So as you've heard from the Permanent Secretary, Kamikamida Health Center in Lautoka is temporarily closed for decontamination. Punja's Health Center and VCC Health Center remain operational. Punja's Health Center will now operate on a 24-hour services beginning tonight. And as you may note, that our female team is currently in Lautoka, and we've asked the team to be on standby to assist at the center tonight if necessary. VCC Health Center continues to care for pregnant mothers From yesterday to today, we've delivered 10 mothers, and we've also referred 4 mothers to Nandi for cesarean section. So we're happy that the arrangement is working well, and we anticipate it to continue to do so. Again, for patients who will present to the clinics, expect to be swabbed for COVID-19, and please cooperate if you are asked to do so. The FIMET hospital has not started today, and but the team are completing the setup and putting the tents and its and setting up the services required for the full functioning of the tents. We anticipate for the services at the FIMET hospital in Lautoka to begin tomorrow morning. The medical ship Webueti is now berthed at Lautoka Wharf to provide support to the hospital, and our medical team, as I have stated earlier, on standby tonight for the Punjab's Health Centre services. As you've also known and stated by PS, Rewanga Health Centre is temporarily closed and will be decontaminated, and the team is working hard to for the centre to reopen on Sunday morning, 9th of May 2021. The screening clinic at the nearby public rental board facility continues, and we are asking patients to again go to Samambula Health Centre, which opens at 8 a.m. to 8 p.m. every day. The Sai Sanjivan Health Centre, which opens at 8 a.m. to 4 p.m. at Sewer Point, and of course the Vanalevu Health Centre, which opens 24 hours a day. Our stationary clinic continues to operate, down by 1 because of the closure of the one at Kamikamita Health Centre, but they still did a lot of screening and swabbing. 4,663 screened and 547 swabbed, for a total of 44,683 screened and 7,428 swabbed to date. Our mobile screening team also continues to move around the targeted areas as stated. In the last 24 hours, there were 20,842 Fijians screened and 549 swabbed, for a cumulative total of 267,202 screened to date and 8,226 swabbed. Our community isolation facilities, the 13 community isolation facilities remain with the 552 beds, and currently we have 46 individuals, positive cases in 4 community isolation facilities. To date, we now have 162 repets remaining in our quarantine facilities in Nandi, after 105 completed the protocol and were discharged today. So we are happy with the team that's taking our quarantine repats through. The rest of the people in the quarantine facilities, of course, as we stated earlier, are primary and secondary contacts of patients. To conclude, I know it's a beginning of the weekend, it's a Friday afternoon, but fellow Fijians, we are well and truly in a fight now. We are fighting this killer disease, and the beauty about this fight is we hold the winning cards. So this is the time to play the winning cards. This is the time to play the practice COVID safe measures at all times card, the stay at home card, the download and activate Care Fiji app card, and of course the get vaccinated card when the time comes. We have to win, and together we can. Thank you very much.
No problem, sir. Members of the meeting will now open to questions. Please use the microphone with your mask while you're asking the question.
Thank you for the update. Dr. Fong, Lee there from Radio New Zealand. My question is to do with all of the outsourcing of services that the government's organized in order to take care of the load that you can't currently. The question is, how is the government paying for this? Where is the money coming from? How much will it cost you to outsource this burden to the private sector? Is it donor funded or is it coming from government funds? And there was another question. Can you tell us how many, this is a follow-up to information you gave us last night, how many FEMAT teams can you activate? Thank you.
Well, my part of the answer is fairly short. You'll need to talk to the Ministry of Economy for that answer. I don't have that answer.
Thank you for that, sir. I suspected as much, but seeing as how you're the only person from the government speaking on this entire pandemic response, I thought that maybe you could pass the word up to the appropriate minister, that maybe the taxpayers of this country could hear from him, sir. Thank you.
I think
Is there a
so.
question?
You saw yesterday that there was I think was it last night? They had a press conference, So they will have their own information system.
Maybe the Ministry of Health then. Maybe you can tell us how much it'll cost you to pay private sector doctors to carry out the work of the Ministry.
See, what we are doing right now is these plenty different arms of government working together. Our job is to arrange the list of doctors that we can work with us. We have sat down with the Ministry of Economy people. We've told them this is a list. This is the kind of conditions that you need to look at. Then they will have another discussion with them about the contracts, finalize the arrangement, and then we'll work from there. But please understand, this is no different from what everywhere else in the world has done. And I've mentioned to you how much support. Yesterday you asked the same question when we mentioned, and WHO also mentioned, and they verified, there is huge number of support that is coming in to us. I mean, we've basically shown our best foot forward in terms of the response to the disease. We've had, many people who are in authority who have told us you are doing the thing that you're supposed to do. And we believe, I believe as a ministry, it's because we're showing our best foot forward, we're getting the support.
Thank you. I will not be able to give you the number of personnel that are currently involved in the FEMAT team in Lautoka. That we can provide that later. But what we have is there's multiple FEMAT teams that are currently stationed around the country. I think PS yesterday talked about the team that's stationed in Singatoka. There's the team that's coming to Lautoka now. We have one in Rakiraki. And also when Ba comes up, we'll also have a team stationed in Ba. I don't have the detail of the numbers, but we can provide that later. Thank you.
Dr. Fong, Eva from Fiji Village. You had mentioned that from 4 a.m. tomorrow morning until 11 p.m. Sunday, those on VT11 and are currently in a containment area, they can move to another containment area, and those outside of containment areas can move into a containment area. So what measures are in place to test and screen those that will be crossing those containment areas? Because the risk of community, the risk in the community is much higher now.
Yeah, this is why we only want you to move from one containment to another containment, and from a non-containment into a containment. We just don't want you to move from a containment into a non-containment. Okay? Given that we expect that there are certain risks that are equivalent, there's an outbreak in Lautoka, there's an outbreak in Suva, the Lautoka-Nandi corridor, we consider that an outbreak contaminated zone. We consider this zone as contaminated. Yeah, you can move between just going from a non-containment zone to going from a containment zone to a non-containment zone is always the hardest. That's the one that we're not allowing. You notice that I also said that contact tracing details will be taken at each part of every border. So we expect that if you say that you're going to Suva, and later on we find out that you went and stopped at Sigatoka and we didn't see your name in the book when you read Suva, the public health punishment is quite severe.
So just a follow-up question to that. Monday morning, 4 a.m., the 14-day period for the containment areas at the moment, so as non-essential businesses that are not opening as of now. The 14-day period comes to an end on Monday morning. Does it mean, with you announcing all this, it'll extend or come to an end?
The way we're making the decision on the length of each containment zone is a day-by-day decision. I still got the weekend to go. I still have to see how many more new cases will come up. I guess one of the things that I really want to emphasize over here is that what we're seeing now is that our fever clinics are working. We are beginning to get a better picture of what kind of load that we had. There were cases that were hidden. Now we're beginning to see that those transmission chains. Once we get a better picture, we can actually be a bit more targeted in the way that we are fighting this fight. But part of the fight is the duration of containment. So duration of containment can lengthen, can shorten, depending on how the shape of the fight looks like.
Good evening, Dr. Fong and team. Corey Tandulala from FBC News. First and foremost, thank you for the work you and your team are doing, and also for those at the frontliners, and for giving us daily updates for COVID-19. Just quickly, Dr. Fong, if possible, would you be able to provide us how safe, or just portray a picture of how safe the Suva and Lautoka area, because at this point in time, there seem to be the high-risk areas as of now, and also for for the people in public spaces, what message would you want to give them in terms of, restricting movements and all those kind of stuff?
Thank you for the compliments. I'll just say this. How safe? We all not safe. Okay? When I say we all not safe, we all have to assume, like I'm talking to you, I have to assume you got COVID. I have to assume that I might be having COVID, or that I've been exposed to somebody with COVID. That is the assumption that we all have to work with now. Because staying safe will stem from that assumption. Now, assuming that we should be taking precautions doesn't mean that we panic and do something stupid. So what we are trying to instill into everybody is this idea that it is not safe to be not COVID safe. That's the idea that we want to push.
Dr. Fong, sorry, just a follow-up question to that. If possible, why aren't we stopping movement entirely, assuming that we are putting people at risk if the cases are still out there?
Asking us to do a 24-hour curfew. That's the question you're asking, yeah? Whether we should lock down and get everywhere in Fiji just to don't move, stay in your home. As I said, if we need to get there, we'll get there. At the moment, I feel that many of our containment zones are actually holding back a lot of movement. I'm also aware of one of the few other problems that we know of. It's harder to distribute food because you have to source food and you have to maintain the supply of food. If people are not moving, they can't produce food. You can't pack food. It's harder to source workers to come and do the distribution. So to us, for me at the moment, it's a nice happy medium when we are doing containment, because it allows us to get things moving. It allows people to patrol those that require more containment compared to others. So this is what I call a targeted form of lockdown, where you have a containment zone, and within the containment zone you have some small lockdown areas that you would work with. It's just a little bit more clever.
Thank you.
Dr. Fong Merioni from Fiji One. I understand civil servants like teachers are now assisting the Ministry of Health. Can you please elaborate what exactly are they doing? Are they conducting screening, swabs? And also, are these civil servants going back home? And if they are, what is the ministry doing to ensure that they are safe?
So the civil servants, none of the civil servants will be doing, medical frontline work. What they do is they provide us support roles. Some of them, today they were distributing food to all the contact tracers. I think you again had some of that food this afternoon. That was the leftover. We also have civil servants who drive the vehicle. But they don't go and take the swab, they don't go and talk to the person. They actually stay a good distance away. So we actually need their help so that we can just concentrate on the medical bits of the operation. We have civil servants who are helping us pull data together. We are putting all the data in one place, and they're helping us to work out this strategy, how many masks you have to send, how many sanitizers we have to put in, how many swabs you'll have to go for this strategy, how many resources of this you'll have to go. They're helping us pull that together, especially those people out at the NDMO, because they do a lot of hurricane cyclone response. So we've got all those kind of things that are supporting the frontline medical response.
So they are not doing screenings?
They're not doing screenings, no.
Thank you, sir.
Sorry, the other thing is that they're not doing the swabbing. They're not doing the swabbing. They may hold the gun, but you see our security man downstairs is also holding a gun. Yes.
Thank you, Dr. Fong. So Lydia from the Fiji Times. So my question is just about those health officials at Lotok Hospital, and that is on how their families are being taken care of during this period.
Yeah, that's a good question. There is a lot of work that is done in the background to take care of the family. Some of the family members are actually on home quarantine, and there's supplies of food that have to go to them. We have allowed people to have communication. There are communication aids that we are working with, providing for those people who are in Lotok Hospital. There is also some degree of support being provided through psychosocial support systems. They're using Zooming mostly for that type of thing. But I think no matter how much we do, nothing will be enough. For that type of situation, if your family member is stuck in the hospital and you at home, it will not, no matter what the government does, it will never be enough. And unfortunately, it's the nature of the beast that we're fighting. This virus that has taken a hold on our society, and it's causing this level of disentanglement and difficulties in maintaining our social structure. And of course, like I said, the best thing we can do for the team in Lotoka is to make sure that we can hit 21 days, and it's only 21 days. So the best we can do, the most important thing is if we don't get too many more positive cases having to go into Lotoka, sick people with pneumonia, because every time we have one pneumonia case, we have to take it to Lotoka. As if it's a COVID-19 case, we'll have to take it to Lotoka Hospital. So every case that we introduce, it introduces a new risk to the group. And that can extend. And the only way we can help that group of people is to make sure that we keep still, stop spreading the virus, and somebody will not have to enter a Lotok Hospital again. Okay.
So I just want to revisit my question from last night. I just want to clarify that I was not after the names of the patients or the case numbers. I just wanted to ask about the number of local cases that have recovered, considering that how this variant is causing a lot of deaths in other countries, particularly India. So I was just after that, so if you could just comment on that.
Okay, I see where you're coming from. You want local cases that have come out because you're thinking the variant sounds dangerous. Okay. I just explain one small thing. I don't have the numbers, but I can explain one thing to you. The variant is more infectious, right? But not more dangerous. Okay. What you're seeing in India Usually, if there's only a few cases, you hardly see anybody die. Said. So the number that die is like the tip of the iceberg. Said. When you see the disease exploding at the bottom here, then all the rare events become common sight. You can see it more often. That's what you're seeing in India. What you're seeing in India is a lack of control, a completely out of control situation, so that now all the rare events becoming common things that you see on the road. The deaths are escalating and it's more visible because there's widespread community transmission. And that's what we are trying to avoid. We don't want widespread community transmission. There's nothing special about Fiji that's we're not seeing, more dangerous cases. No. It's because our scale is still too small for us to see a lot more serious cases. But we all pray that, with all the effort that we're doing, we will not get there. Eh?
Dr. Fong, you talked about launching wide-scale testing to address community transmission in the containment areas. My question is, do we have the capacity to do a large-scale testing and also have we set daily targets? Have we set targets for testing, daily, monthly, as a means to gauge our progress in that regard?
Okay, so in terms of testing, the WHO standard to assess your level of community transmission is about, I think it's 2 per 1,000 per week, right? So for us, that will equate to about 1,700 tests per week. We are doing a lot more than that. Last week, we tested, I think, close to 7,000 samples. What we're trying to do now is target it to the containment zones, so Lautoka, Suva, etc. Because we found that with our mass screening, we're doing it all over Fiji, we're doing the mass testing all over Fiji. If we target it a bit more, I think we'll find more cases and the results come back in a timely manner. So that's what we're trying to do. That's a change that we're making today.
Thank you. Just a follow-up. Dr. Lisha, how much or how many of those tests that have been done, unique tests? Because I understand that you'd have multiple tests for individual to test.
That's a good question. We don't differentiate the test according to how many tests we're doing per person. So that's common in other countries as well, where we just count the total number of tests.